This first case was a young man, previously healthy. We haven't been able to identify a patient zero, and 24 hours after this first case, there were 36 new cases without links to patient one.
So I remember hearing that he was very sick, but he was, one person, and that I think happened either in late February or early March, and that's when things started to really ramp up. And it really feels like it went from being kind of something that wasn't that big of a deal to being a humongous deal in like a heartbeat.
The first case was actually in January, but then the steady stream of cases was sometime in the beginning of March. And it became fairly obvious that in a country like India, it would be very, very hard to contain this.
And you're realizing like, this is going to hit us in such a way that it's like being in the ocean and like a wave's about to like crash over you. Like you're trying to brace yourself, but you never know how hard it's gonna be and how many times you're gonna flip in the water.
Mid-January, early February, we started to really start to think about like how we were going to do resuscitations, what we were going to do if we had a lot of COVID patients, because Markham Stouffville got hit hard by SARS, or so I've heard. And so the staff were already very scared and nervous.
So there are a lot of people who I work with. Some had SARS, some worked through SARS. And that was, I know that when we started to have those initial meetings saying that this is coming, you could see it on their faces, and the people who had lived through that again, the people would outwardly express, they said, I can't go through that again, because there were a ton of people, there were a number of people in the ICU who lived through that.
I had been, one of the early things I thought about was the Toronto experience with the first SARS virus and how catastrophic that was for healthcare workers in Toronto. And having worked there, I think I was more aware quite early about how working in critical care was going to put us at increased risk.
And there were several of those people that said to me, like, I'm in my late 60s now, like I more than want to help, but I don't want to, if there's no PPE, if we don't have the right stuff, I don't want to walk into the lion's den at my own expense. And it was a really difficult situation to rationalize, because we never had to go through any of that in SARS 1, and never really had to think about that type of thing for anything else we do in medicine. Certainly not in our part of the world.
The most stressful thing was the difficulty in providing enough personal protective equipment to the doctors. So every day I received phone calls from, for example, the directors of the hospitals, and they were saying, okay, we have PPEs for one day. Are you going to send us other equipment for the next, a week? And they were buying everything that was available on the market at every price.
Everybody was kind of frantic about the PPE and not knowing what you needed to have to make yourself safe. And everybody was just kind of making everything up and, doing what they thought and doing what they thought was right. I remember people freaking out about masks. It's interesting to think back about it, because at the time everybody was being, you wanted to kind of ration the PPE that you had.
Yeah, there's fear and anxiety, and you're sweating, but you just go in and do your job and then get out and take a deep breath and, okay, I did it. But everybody felt that. So there was everybody was looking out for everyone. And even if, a nurse noticed something wasn't right on me, they would tell me, and I would do the same for a nurse, like, this is not quite right, or you have a gap here, or whatever. So it was very scary and stressful, but I felt very close to people at the same time. I felt closer to people during that time, because everybody knows everyone has a family and we're just looking out for each other.
And the first patient like coughed, and I got secretions on my neck, and that was the only part of our body that wasn't covered. And I was scared then. And then I came out of the room, and because I didn't leave, I just wiped it off and continued. And I lined the patient, came out of the room, and told our RT manager who was there then, I said, he just spat a whole bunch of stuff on my neck. And she literally got a bottle of alcohol and threw it on my neck and said, go clean up. So I think that was the first time I was worried, because we had 4 back-to-back intubations. And then I realized, thinking, if this is day 1, what is it going to be like at the peak?
We were full capacity. On March, we opened a second unit. And the patients there were pretty bad.
Having contingency plans for having enough ventilators or having enough space or not having enough physicians, that was the stuff that kept me up at night. Or if physicians were going to get sick, again, you'd have backup schedules and backup schedules to the backup schedules. But at some point, the math wasn't going to work out if it was really going to be this huge wave that we were seeing.
And then I guess the anxiety then moved from how am I going to go about protecting my family and stopping myself from bringing it home to my young family as well.
And so my brother is great, and he lives out on Long Island. And so, he offered, and we talked about, if we really need to be at work all the time, can you take my kids? I took the risk and decided to keep them with me. But I think that was really difficult, that thought of sort of breaking up my family in order to do the work that I needed to do. I ended up and I know people who did do that, who didn't go home for a month and who lived in hospital provided housing, sort of in the student dorms. And I know people who did do that and they didn't feel comfortable. And, but that was a point where I sort of was like, wow, I think this would have really broken me. I had to do.
I had the discussion with my husband. So I'm being very safe at work. Obviously, this is a scary time. But I guess it was very selfish. I didn't want to be away from my family. And my daughter is so small. And I think because things were so hard and so stressful, and she was like my one light. So I didn't want to give that up.
And I wrote an email to my kids, because I was like, if I get sick or I get quarantined and something bad happens to me, I need to tell them certain things. But I wrote this letter, I drafted it up, and I had it ready to go. And same for my parents, and same for my husband and a couple of my really good friends, because I said, if something happens, they need to know what I feel and how that I will always be there with them, even if I'm not.
Going to be, even though I thought I was being very safe with my PPE, I was terrified that I wasn't doing enough I was going to bring it home and my young kids were going to get sick, and then what do I do? Then what happens? How bad is it for kids? Nobody knew anything, right? So that was always just the most horrible, stressful situation every day, going into work being like, okay, is this the day that I get it, right?
So there's still a lot of fear and stigma, even though there's lots of awareness and the media campaigns that have been going on. And that's something that's been very hard to change, I would say. That still continues. There are people who don't get tested for that reason. I know of doctors and nurses who don't get tested and just go into home isolation because they fear that if they're tested, they won't be allowed to stay in the communities that they currently live in. And several instances of people being in the middle of their illness, sadly being asked to vacate. One of my residents had that really terrible experience where he had symptoms, fortunately just mild symptoms, but he had to actually move houses while this is going on. His landlord asked him to vacate pretty much the next day. So all these kind of horror stories that we have actually heard and even some of our colleagues have faced.
One of the greatest fears also, not only our family, but our hospital family. And the moment when, we also had one of our cardiologists there. I intubated him. And it's so hard. It's so hard. Knowing the person and having to be there and just telling him, okay, you're going to be okay, But because what are we going to say? What would you say?
Is that you had to facilitate the phone calls with the family at home, and those conversations still they're difficult to think about, and I think about them because they had, you're privy to these intimate conversations that are so coherent and they're so private, and both of those patients ended up dying, and I remember thinking that it was a really emotionally draining part of that night, but that one was hard. I remember crying that night actually, and I don't really cry.
But in these past couple of months, holding up an iPad and having loved ones talk to the patient who's like intubated and sedated and can't hear anything, like you are a link in that memory for that person. And I think a lot of us, we didn't realize how much of a burden that was going to be. That's a big responsibility, to be a placeholder for somebody's family. And taking away, you felt like you were taking away somebody's like last moment with their loved one.
The biggest contribution or the biggest impact, if a particular healthcare group has made, it's really the nurses. It is always the case, I think, but there's a better appreciation of that fact, a better recognition of that fact, especially in a healthcare system like India, which I was talking to you earlier about the hierarchies and so on. Whether it is the empathy that they provide, whether it is the 24/7 care that they provide, and the fact that they actually spend a lot longer in PPE than us. So they actually do a 6-hour or 8-hour shift in PPE and stay in for the whole duration. It's physically exhausting, and then they're taking care of these patients who are really sick. There is they have to be more than nurses. They have to be the family. I think it's just incredible what they do.
You really got to see the good in people. You got to see people. So one of the things that our surgeons did, because they weren't doing any surgery, is like within literally 24 hours, they created what we sort of lovingly termed SWAT. I think it had like an acronym, but basically it was all the surgeons and residents got together and did all the procedures, like all the other lines, all the other things, NG tubes, whatever you needed, it was done by them, and everybody was so willing to say yes to whatever was asked of them.
The surgeons their ORs had gone 16-4. They were like, we'll take on trauma team. We'll take the trauma, the whole trauma program. We're going to come off your docket. The general surgeons, so they had like a 2-day ATLS crash course, reverb for all the general surgeons, orthopods, like to take that over. It was amazing. Like they definitely changed. I think it cemented a lot of collegiality very quickly. Probably accelerated 10, 20 years of your normal day-to-day interaction, like very quickly over a few weeks.
A dedication and the willingness to cooperate of a lot of people and a lot of centers that I would have never imagined. Like everyone was really, really working like 24 hours a day, trying to do their best and trying to increase the offer of ICU beds. and everyone was helping each other. I think that if this cooperation among centers in the network was what really allowed us to admit such a huge number of patients in a limited period of time.
I just love working with the people that I work with, and as I said, I trust them with my life, and I have such a huge amount of respect for their dedication, for their intelligence, not just the leaders, but of course the intensivist group I work with, the nurses we work with, the other physicians. That was one of the most amazing things to see, that nobody ever said no. Everyone stepped up, everyone volunteered. They called me to say what could they do. People were just so willing to help, that relational piece for sure at work got me through.
I never felt more supported by that group of people. I mean, even if you were the person in the room, and if you just looked out to the door or the window, there was always one or two sets of eyes looking at you, basically saying, I got you. And that was always a comfort. You're never alone. So that was very necessary, very needed.
Some people talk about silos within a hospital. I think the way our hospitals come together and different departments working really effectively together, better than ever in any other context I've ever seen. I think that's been absolutely incredible. So in the face of this, I'm incredibly proud of the way our hospital and our departments come together to sort of work on this together.
There's a lot of friends at work that I have now that, because we sort of went through all this together, your like bond sort of strengthens, right? And there's some people you're just like, okay, this is like, I'm so proud to be working with you. This is just such an amazing feeling to be here standing by your side.
And I was like, these people, we all depend on one another, and they are really an extension of my family. So we really rallied together and we stuck by one another. And I think that helped me anyway so much, because I knew people were worried, about my well-being as they were about their own well-being.
And I have the privilege that I work with friends. Some days are hard, and you think that no matter how hard you struggle, it won't work. And sometimes it's like disappointing. And in that moment, I have my team, and I have my family, and I have my friends, and they care, and they like give me energy when I don't have more.
I was involved in the entire process of fighting, of facing this outbreak. And I am sure that this changed me a lot, and is changing me a lot. I can't tell you now what really changed. Maybe I need some more time to realize. I don't know. For sure, I'm tired, stressed, but this is. But it's not only that. I think. I think I need some time to really focus on what happened and to realize what the consequences of this on me personally.